We've been checking in very regularly with Montreal Gazette health reporter Aaron DERFEL, and earlier this week, we spoke to him about the state of Montreal's emergency rooms yet again and how more and more Montrealers are leaving without ever having been seen by a doctor. Now, Aaron has written 2 more articles since then as he continues to shed light on the crux of this, very troublesome issue. So one was on the fact that our ERs are falling way short of Canadian triage guidelines. And his latest today shows that patients are in a lot worse health now than they were 5 years ago. I might have those reversed in the order that they came out, but it's hard to keep up, Aaron. You're so on top of this story. Thank you for joining us, Aaron DERFEL. Thanks for your time.
My pleasure, Natasha. No, you summed it up perfectly.
Every time I read it, I think, what more could there possibly... I mean, is it like that for you as you're writing and researching this? Do you keep thinking, what more could there possibly be to say?
Yes, precisely. And one of the things that I'm doing right now, this picks up on what we were discussing the day before yesterday. I had asked for some data on the death rates of all the various ERs in the city. And I was told I had to file an access to information request. I know that they have that data, but I have to jump through those hoops to get it. And what we're speaking about really is how ERs have become less and less safe because of a number of factors all crashing into each other. You're talking about an older population, people whose medical conditions are more complex. You have fewer staff. And this results in overcrowded ERs with, hospitals are not supposed to turn away patients, but some of these patients are turning themselves away from ERs. I wrote about that 2 days ago. And then there's the issue here of when a patient comes into the ER and say they have a very serious, condition and they're triaged, right? So you don't want to let those who might just have a cut get triaged earlier than someone who might have a very painful leg fracture. Mm-hmm. You treat that person a little bit earlier, and they're supposed to follow guidelines. And at the Royal Victoria Hospital, for these P3 patients who should be triaged within 30 minutes, it's almost 6.5 hours.
Oh my God!
And I mean, it's just astonishing. So yes, it is this litany of surprising revelation after surprising revelation.
Not even close to the Canadian triage guidelines. Good grief, 6.5 hours. I just want to circle back, Aaron, for a moment, with what you said about this, you having to file an access to information. At this point, you'd think they would just be handing this stuff over to you. Why do they not want this information out there when the intention obviously is to try and make things better?
Well, you'll recall a few months ago I wrote a story about a series of stories about the situation at the Lakeshore General Hospital, and I had documented 6 patient deaths that the clinical sources said could have been prevented. After that, there was a government investigation, and Francie Dupuis, in her report, she noted that the Lakeshore had a high ER death rate, but she didn't say what it was, and so I've contacted the ministry for the information. In the past, they'd give it to me, but this time they actually want me to file an access request. So my suspicion is that they don't want this information out because it will be quite damning, and they don't want people to realize, that say this ER, that the death rate, the number of deaths per say 1,000 ER visits is that much higher than another ER, because it will raise questions about perhaps mismanagement.
Mm-hmm, about competency, and yet I can't help but think, that fear is illogical in so much that no individual can possibly be to blame here. It's mistakes are going to happen when the system's this damaged.
Absolutely, yes. So this is not, I'm not trying to, and I don't think my reporting is trying to do that at all.
No.
As you mentioned, to find fault with an individual physician. What we're talking about here are medical staff who are short-staffed, right? And they're under-resourced, and they're put in these impossible conditions. That's why this ER doctor I spoke to at St. Mary's told me that they have to say a prayer before the start of each shift.
Now, this idea that patients are sicker and sicker, I know one of the doctors, I think it was at Maisonneuve-Rosemont Hospital, told you that it's gotten worse in 5 years. ER patients are sicker. Is that just endemic? Like, that's what's going to happen given this situation, is it not?
I think that's a function of something else. We know that our population is aging, so the patients who are coming to the ERs today are a few years older than they were 5 years ago, and that's just inevitable. But what I was told is that during the pandemic, some patients had put off going to the ER. They had some type of problem, and they put off going to get it addressed at a hospital, right, worried about outbreaks. And whatever it was that they had, it could have been a problem with congestive heart failure or chronic obstructive pulmonary disease, and they just put it off, or their diabetes, and until just only recently. And so when they do show up, their medical problem is that much more severe. Then you have another group of patients who might have contracted COVID. I'm talking about people in their 70s and 80s, and they survived COVID, but it made them weaker, more frail. And so, they're showing up at ERs, not necessarily with COVID, but, their comorbidities, it's like all the different medical conditions, they're harder to stabilize. And this is a big challenge. Mm-hmm. It would be under normal circumstances, but it's doubly more difficult because they have fewer staff. Some at the Lakeshore, for example, they need another 50 nurses. And so when you're so short-staffed like this, what happens is that patients wait longer to be admitted into the ER. When they're in the ER, they're waiting longer in the hallways. Errors start to creep up. The conditions of the patients deteriorate, and that's why overall, the death rate in ERs across the province has risen from something like 59 or 5,800 4 years ago to, I think, the latest tally would have been 7,400 in the last fiscal year. So it really is a serious issue. It's not unique to Quebec, but it is a problem across the country. But I think it might very well be more severe in Quebec because our healthcare system was weaker than the other provinces before the pandemic hit.
Aaron, I've got to get to news, so we're out of time. But just, I would love your quick answer on this. There's no question the government is very aware of the work that you're doing. I think they probably see you as a bit of a nuisance because you continue to shine light on the system flaws. But do you have any sense that the government's actually listening and making adjustments?
They're following this. They are following it closely. Yeah. But I think that it's time for a national, inquiry, a national commission, coast to coast, not just in Quebec, into the question of the pitiful state of our ERs. Only when something is done nationally will that, pressure provincial governments to act.
Thank you so much, Aaron. Keep up the great work.
My pleasure.